This video is an introduction to some privacy and security considerations for personal support workers and homemakers. We know you handle sensitive and confidential information every day, in many different forms and in many different places, about your clients, about your community, and about your organization and colleagues. So, let's walk through a typical day and talk about the kind of information you might handle and some considerations for protecting it. Your day may start with receiving a schedule of who you are going to see for the day. Your schedule may be on your phone, on a paper calendar, or on a sheet from the coordinator. This may include information such as client names, address, and contact information, and services you will provide. All of this information could be considered sensitive. Even schedules using client initials can be considered sensitive if you think it's possible to identify your clients from other information about them in the schedule. If you're also taking notes during your visits, think about what sensitive information you may be recording. Client health information, services you provided, follow-ups they may need, and anything else you need to write down. It's important to think about what you write in your notebooks and make sure you always have it locked up securely or carried safely with you. If you're unsure if your notebook contains sensitive information, just think about how concerned you would be if you misplaced it. If the thought of that makes you feel uncomfortable, it's likely there's some sensitive information in your book. Check in with your manager or supervisor to find out what to do with your notebook when it's full. You may need to destroy it or store it securely. You may also be using a mobile phone for work. This may be a personal phone or one that has been provided to you through work. Lots of people use their phones for communicating with clients and colleagues, through text messages, messenger apps, email, or for the phone itself. Phones can also be used to take photos while you're with clients. Many of those photos, though, could be considered sensitive, especially if they're related to services like wound care management. Some of the best ways to ensure sensitive information remains secure on your mobile devices are to password protect your phone, not share your phone with friends and family, turn off all pop-ups on your phone, ensure texts and emails do not include identifying information about your clients, and remove sensitive information from your phone as soon as possible. If you have questions on how best to secure your phone, talk to your supervisor or manager. Think about what else you carry around in your bag, or in your car, or in your pockets. Do you have client file folders, a laptop, tablet, or camera that you use for work? How about keys to the office or keys to filing cabinets? Maybe even keys to client homes. Consider how these items might be secured best in your car and as you go throughout your day. Okay, let's say you arrive to your first client of the day. You may carry your bag into the client home. Be aware of where you place the bag as it may be accessible to clients' family, friends, and even pets. In some cases, it may be helpful to request a locking bag or case to protect the confidential information you carry with you. Your client may have other people in their home, so it's important to ensure that any sensitive information you discuss with them is not overheard by anyone other than the client and the people that they have indicated they're comfortable sharing information with. You may use your notebook, laptop, or phone to record notes about your visit. Consider where you place these things and who may be able to see your screens. Some home and community care programs keep care plans for clients in the client home. Consider the type of information you input into the care plan, as it is possible it may be viewed by others in the home. Also ensure the care plan is kept in a place that the client has approved. Okay, off you go to your next client. Throughout the day, you may need to make and receive calls about clients. Make sure you are having these calls in secure locations where you cannot be overheard by clients, community members, or other service providers. As the day goes on, you will often be seeing more than one client. Some clients will know, see, or guess that you may have seen other community members and ask how they are doing. These conversations can be challenging, but it is a best practice to not disclose any information about clients, including even basic information such as who your clients are, and instead to indicate that individuals should directly contact each other if they have concerns. If you need extra support about talking to your clients around the health center's privacy practices, ask your supervisor or manager for some information. Some home and community care teams request that clients sign off after each visit from a personal support worker and homemaker to indicate they have received their services. If your team does this, make sure that each client only sees the details of their own visit. Get each client to sign on their own page and then file the signature page away securely. After you see your last client, you may head back to the health center to document your client's services and share some information with your colleagues to assist your clients. You may need to share information with the outdoor worker, home and community care nurse, or coordinator, or the front staff. Don't forget that some of the information you share will most likely be sensitive, so you'll need to consider who can overhear your conversations, whether it's other clients, community members, or staff. Even though all health center staff will have signed oaths of confidentiality and are bound by privacy and security policies and procedures of the health center, they still only need to know sensitive information about clients that directly relates to the services they provide. If you have office space, either your own or shared, there are a few privacy and security considerations to think about. If you're using a computer, remember that sensitive information may be contained in electronic charting notes, emails, documents, photos, or calendar appointments. To keep these secure, ensure you have your own unique login ID and password. It's important that no one else knows your password, even the IT team, as this is unique electronic signature. Even though passwords can be hard to remember, it is a best practice not to reuse or write them down. If you don't have your own login ID, talk to your supervisor or manager and let them know you need one. You may also store confidential client information in paper files. These can be anything from paper charts to sign-off sheets, attendance lists, schedules, and reports. Make sure you store these paper files securely in locked cabinets accessible only to those service providers who need to see this information. Sometimes confidential information is written on sticky notes and paper calendars in your office. It's a best practice to adopt a clean office policy, meaning that all confidential information is kept out of view from anyone entering your office. If you use a phone to communicate with clients and colleagues, remember that sensitive information is often discussed and you should minimize or eliminate the use of speakerphones and paging systems. Other places you may have sensitive information in your office may be on faxes, printouts, client files, and notebooks. If you are sending faxes, always use a cover sheet and confirm the fax recipient can securely receive your fax. Make sure notebooks, client files, and any mail containing client information are locked away and not left on your desk or in another unsecure location. You may have been issued also a number of keys, access cards, and codes to the health center, offices, rooms, drawers, and for filing cabinets. It's important that you only have access to areas you need to provide your services. Also remember not to share keys and access cards or codes you are responsible for. If you feel you have more access than you need or have some mystery keys, please talk to your supervisor or manager. At the end of your day, if there are papers to dispose of that may contain sensitive information, don't forget to put them in the shredder instead of the garbage or the recycling bin. There are many pieces of privacy and security to think about in your day-to-day work. It's always helpful to talk to your colleagues, teams, supervisor, or manager. Together, you can discover some creative and effective ways to protect client privacy and ensure information security.